Picture a healthcare system where universal access isn't universal access, where people pay more in taxes and take home less, where people experience longer wait times before they are eligible to get the urgent procedure where care is subpar. The nations that compromise for universal healthcare are nations of exorbitant taxes and far fetched treatment options because the government controls it and, in the end, determine who gets what. Universal healthcare would harm any nation by increasing taxes, reducing quality of care, and creating longer wait times, making it an unstable model for the country. While universal healthcare may seem like a great idea, implementing it would be disastrous for anyone because it increases taxes, decreases quality of care, and results in longer wait times. Universal healthcare is already a faulty system, and on top of that, too many employers and citizens would have to adjust to a new system. Furthermore, universal healthcare promotes increased demand and acceptance when everyone is entitled to something. That means when everyone is going to want it, doctors' offices will be overlooked and quality of care will decrease. To elaborate, countries' universal healthcare have longer wait times for appointments and longer wait times for surgery. Americans cannot afford, literally and figuratively, to wait 2 months for something that needs to be fixed yesterday. Therefore, while it is nice to have a plan, it's not practical or effective in the long run. I would like to begin by talking about how you still pay for healthcare even when the government provides. When universal healthcare is brought to a country, taxes are due to increase because that's where they get the money to fund it. Universal healthcare requires money, and a lot of it, to support healthcare needs of an entire nation and population. This money comes through taxes, increased income, sales, and payroll taxes. According to the Manhattan Institute, taxes would see an expected increase of 32.6 trillion over a 10-year period if implemented. For example, when one looks at a country with universal healthcare like Canada and the United Kingdom, one sees increased income or sales tax because people know that a certain percentage annually compounded is given to the government for this healthcare initiative. However, these are not arbitrary increases for some to get healthcare. These are mandated increases that the entire population requires for basic everyday doctor's visits, surgeries, and billing per administrative visit. Thus, a universal healthcare plan does not sound like a good idea because, in reality, who wouldn't want healthcare? It becomes a disruption for families who are struggling, and inflation would also increase. Secondly, by implementing universal health care, you add a lot of extra patience and stress on doctors. Common colds and other abnormalities that someone wouldn't normally come into a doctor to see would increase. Patients receive a lower quality of care when universal health care is implemented. More people getting treated means more overwhelmed systems. There are fewer specialized options and less incentives for doctors to specialize. For example, multi-million dollar hospitals and family practices get lost in the shuffle. Unable to afford updated equipment, they're stuck with old machines and outdated bureaucratic methods. In addition, doctors and nurses are stretched so thin with patients that they become burnt out and forget about the little details that matter. This, coupled with the fact that most doctors would be taking a decent pay cut, would lead to some doctors feeling discouraged to provide the top quality care that they would normally give. Currently in the US outperforms similarly wealthy countries that have implemented universal healthcare in multiple areas, in patient health and safety. According to Peterson KFF, specifically in the US, has a better percentage for deaths after 30 days of hospital treatment. Therefore, when everyone has access to treatment of lower quality, those who do get on universal level and thus negates the purpose of trying. Longer wait times are one of the biggest arguments against universal healthcare is that wait times for surgery and specialist visits are far greater because everyone has access. The demand is greater than what a universalized approach can handle, with non-life threatening elective procedures and even preventative care taking longer to get. For someone with a relatively minor issue, this is an annoyance. However, for someone with a significant multifaceted problem or delicate concerns, this is unacceptable. For instance, according to the National Health Institute, they found that 62% of Canadians were waiting longer than a month for specialized healthcare. To give you a reference point, that number in the US is 31%. This can be a matter of life or death. Sometimes getting that specialty care faster can lead to catching a disease or illness faster and potentially saving a life. Therefore, universal healthcare wouldn't work as efficiently because it increases the wait times for care and increases risk to patients. So the next time you visit a specialist in under a month, be grateful that although you had to use your insurance, you can rest assured knowing you're getting the quality care at the fastest pace possible. Ultimately, keep these 3 points in mind. First, universal healthcare is an expensive endeavor and tax dollars that citizens and businesses across America will have to pay. Second, universal healthcare is rife with reduced quality of care as providers are overstressed, underpaid. Third, universal healthcare is lacking in access as patients experience much longer wait times to receive necessary treatment. Therefore, while universal healthcare sounds like a dream, it ultimately in practice hurts a country. Something better is required to provide people with access without stifling quality or being such a socioeconomic burden. I encourage you to continue to be against this form of healthcare and prevent it from spreading to other countries it may harm. So while you ponder the future of healthcare and the response to this query, consider this. Is universal healthcare worth it? Because in a few years, you'll be the one in urgent care with a wait list and no treatment options. This is not a question for today, but a question for our survival and others.